just saying we trade notes. I think it's still morning, right? So good morning, everyone. Thank you, Barbara, and for the work of the Betsy Lehman Center for the strong efforts to improve patient safety in healthcare in the Commonwealth. Today is another milestone in that journey of patient safety by officially launching the Massachusetts Sepsis Consortium. So I have three primary objectives. I will be brief, being at the podium today, in addition to thanking all of you for being here, which is, as I said, an important day for patient safety. First is to officially mark the creation and collaboration anticipated of the newly formed Massachusetts Sepsis Consortium on behalf of Governor Baker. So it is my job to declare that today, September 13th, 2018, is Sepsis Awareness Day in the Commonwealth of Massachusetts. I don't think I've ever been able to declare something before. From this day forward, we will aggressively, the governor and I sometimes have this debate about whether we use the term aggressively or assertively. I remind him I'm a social worker, so I usually use the word assertively. But on this topic, I am going to say we will aggressively work to improve awareness and early detection and treatment of sepsis and reduce preventable harm and death in the Commonwealth. I have every confidence, and I don't have confidence on lots of things, but I have every confidence that this statewide effort to raise awareness and to advance prevention, detection, and treatment of a condition that each year threatens the lives and well-being of thousands of residents in the Commonwealth will yield positive results. My second objective, although probably unnecessary as I scan the audience, is to remind us as to why increasing sepsis awareness is critically important. No one is immune from this condition. While certain groups are obviously more at risk, sepsis can affect any man, woman, and child. Sepsis is the body's life-threatening, overactive, and toxic response to an infection. It can stem from something that seems rather minor, or it can stem from something more serious. But it can quickly become quite serious, leading to tissue damage, organ failure, and death. Sepsis is often difficult to detect because its symptoms can be mistaken for less serious illnesses. And even a few hours delay in treatment can mean the difference between life and death. It's important for all of us to recognize the six signs. It affects more than 40,000 Massachusetts residents every year, leading to about 7,000 deaths. And in fact, sepsis is the most common cause for hospitalization here, apart from normal labor and delivery, and the third most expensive cost of hospitalization. The good news is that sepsis is treatable if caught early, but patients need to know that the symptoms and seek treatment quite quickly. That's why the consortium was formed. A group of more than 20, I had 25, so apparently I'm now at 30 and counting, representing government, healthcare researchers, patient and family advocacy organizations. I'm a strong believer of true collaborative work to address pressing health challenges. It requires sustained commitment from a broad spectrum of stakeholders. So I look forward to the work of this group in the coming days and weeks ahead. My third objective is to put a human face on the impact of sepsis. Data shapes the questions to be answered and identifies sometimes the solutions. It's the personal narratives that hopefully fuels our passion and sense of urgency and provides the names and faces behind those numbers. And I know you're about to hear from two individuals who have the strength to tell their stories in a few moments. So allow me to share a third. My sister, Susie. 3 summers ago, my sister died from sepsis. You probably can't see this. She was my older sister. We were each other's rocks. I'm the little pudgy one. Yes, I was pudgy at one time. I won't tell you all of our family story, other than to say that we lost our parents when we were young. So my older sister and I, for years and years, were each other's rocks. On every Saturday, up until the week before she died, every week up until the week she died, every Saturday my sister and I talked to each other. My sister was in healthcare, I'm in healthcare. And we did not see the signs. We knew that she had a serious illness, but she died from septic shock. So I stand here, one of the reasons, and Barbara certainly didn't know that when she invited me to be here with you today, but that it's very personal for me. and I know it's very personal for everybody. I would be here anyway as Secretary of Health and Human Services for knowing how important this is, but I wanted to stand here with all of you to say we can do this so that many Susies out there and all of our family members wouldn't have to experience the pain that my niece and nephew experienced without the loss of their life. So thank you for having me. My apologies